Hello everyone, I'm La-arnie and for today's video I will show to you how to input data on electronic medical record using OpenMRS. It is very useful and accessible, especially when you have a hospital records or demographic data of the patient that needs to input on electronic medical records or in computer system. And log in by typing the username and password. For this demonstration, I select in patient ward, then register the patient. In registering the patient data, we must input the accurate information since this will serve as identification of the patient. Then ensure that we give the right care to the right patient. Here we have the name, gender, and birth date under the demographics, address and phone number under the contact information, and relatives under the relationships in case wherein the patient need companion or guardian, especially children's or under legal age. Then recheck the information, then confirm. Next, click the Start Visit. Obtain vital signs. So here you will need to fill the necessary information given like the height, weight, and automatically computed BMI, which is essential since it is also a factor that indicates the overall status of the patient. Next is vital, which is also important to have a baseline data and the urgency of patient status. Again, recheck and confirm. Next, click the visit note. Here we will make the nursing care plan. Input the medical diagnosis. So here the medical diagnosis is asthma. The clinical note. Here we will input the diagnosis and elaborate the NCP starting with the assessment. So here provide the subjective cues and objective cues such as wheezing upon inspiration and expiration, dyspnea, coughing, sputum is yellow and sticky, and restlessness. So, for the diagnosis of the patient, ineffective breathing pattern related to presence of secretions as evidenced by dyspnea and productive cough. For planning, I provide the short-term and long-term objectives. After 1 to 3 hours of nursing intervention, the patient will verbalize awareness of causative factors, manifest signs of decreased respiratory effort as evidenced by absence of dyspnea. After 8 hours of nursing intervention, the patient will establish a normal effective respiratory pattern. And demonstrate behaviors that would improve breathing pattern. For implementation, assess the client's vital signs as needed while in distress. Assess respiratory rate, depth, and rhythm. Assess the client's level of anxiety. Assess breath sounds and adventitious sounds such as wheezes. Monitor oxygen saturation. Plan for periods of rest between activities. Elevate head of the bed and change position. Of the patient every 2 hours. Encourage deep breathing and coughing exercises. Encourage lower or deeper respirations. Use of first deep technique. Encourage increase in fluid intake. Advise the patient about the environmental factors. And administer medication such as bronchodilators as ordered. I also provide the evaluation here. Then click Save. Then select attachment. Here you can attach patient record. Okay. Then click Admit to Inpatient. You will see the date of admission, admitted by, and the ward that the patient admitted. I select here Inpatient ward. Here you will see the summary of what I input, and we can also add or edit other information to provide an effective patient care. So, click the name of the patient. Then here you can add allergies. It is essential to avoid or decrease the incidence of adverse drug reactions. Based on the patient, she have an allergy to egg that caused itching and it is mild. Then click Save. Again, click the name of the patient. You will see here the summary of patient information, including the diagnosis, latest observations, health trend, summary, weight graph, vitals, appointments, recent visits, family, attachments, and allergies. Then click End Visit. Then I will demonstrate now on finding the patient record. Click Find Patient. Then type the patient name or patient code. It is essential to ensure that it is successfully record the patient data. Okay, then click. Okay. Don't forget to log out to secure the privacy and maintain confidentiality of the patient data. Now for the signs of workflow to support the use of an electronic medical record in healthcare management. First, we must log in using the username and password. Then register patient or find a patient if there is an existing patient data. If there is no patient record, click register patient, then input the necessary information of the patient. Then recheck and confirm. If the patient have record, click find patient and search using the patient code or name. Click start visit, then admit to ward, which is inpatient. You will see here who admitted the patient and the time and date. Then next is capture vitals. It is essential since this will serve as baseline data of the patient. Next, click visit notes. Here you will input the nursing care plan based on NANDA. Then allergies. It is important to avoid the harm to patient. Next, if necessary, we can attach file wherein you can put here the files such as the records of the patient. After that, click end visit. Then it is important to log out to avoid unauthorized access to patient data. The benefits of EMR are the following. First, it saves time compared to traditional medical record, which is paper-based, that consumes a lot of time writing the data. Second, it provides an organized record which reduces the workload of the healthcare provider and easy to find the data since computerized. Third is editability, wherein we can edit the information that we encoded that leads to avoidance of error. Fourth, it secured patient data privacy since it is locked by username and password to access the data of the patient, which an authorized person cannot access. Lastly, it is easy to use since it has a design interface that is only necessary for the website.